Welcome to the 10th session of Healthy Heart, Healthy Life Pune series. Today we are going to talk about an important subject, unstable angina. Something unlike stable angina, which can present as an emergency also. I am Dr. Neelkant Karandikar, cardiologist from Pune. Please note down my WhatsApp number 98220 I do both non-invasive and invasive cardiac procedures. I am the Honorary Professor Emeritus in Cardiology and the first gold medalist of the Bombay University at the DM Cardiology examination. Heart is the only machine that works without any rest for years. Keep it always happy, whether it is yours or others. We have seen in previous sessions what is ischemic pain like. It is called as angina. It comes as pain or discomfort in the center of the chest. It can go up to the neck, jaw, left arm, inner side of the left arm, left shoulder, and inner side of the left arm, sometimes right shoulder and inner side of the right arm also. This stable angina is many times present for several weeks or months. And there is, over this period of time, there is no significant change in its frequency, duration, severity, and the effort tolerance possible for that person. Now, let me give you an example. There is a professor who goes to the college thrice a week for conducting lectures for the students. The lecture hall is on the third floor and there is no lift. And as he climbs the 3 flights of stairs and reaches the hall, he gets mild chest discomfort which lasts for 2 minutes and then slowly dies down. After a little while, the pain goes away and the professor begins his talk. The talk is completed uneventfully and then he climbs down the stairs after answering the students' questions. Now, as far as this chest discomfort is concerned, it comes every time he climbs the 3 flights of stairs. So the frequency is constant. It doesn't come at any other time during the day. The severity is the same, which is mild. The duration is the same, around 2 minutes. And the effort tolerance, that is climbing 3 flights of stairs, is constant from time to time. So this pattern of pain or these characteristics of pain remain the same, have remained the same over weeks or months, and it is then called stable angina. And this means that the coronary artery obstruction that is the arteries providing blood to the heart, the obstruction is there but not progressive. Now, what is the story inside the heart? Let us see this picture. There is a blockage in the coronary artery. As you can see here, this is around 75%. Let us talk about this. And this person has stable angina and there is a disease in the artery. But if you take a cross section of the artery, you can see the wall of the artery here. There is a lipid core, which is a characteristic of atherosclerosis, which we have discussed earlier. And note this cap and the thickness of this cap. This is quite a thick cap on this lipid core. And such patients have stable angina. Maybe even if he has 75% obstruction, the angina will be stable and stable in duration, frequency, severity, and the exercise tolerance will also be the same over weeks or months. Now see what has happened here. This particular cap in this artery is thinner than what we saw earlier, and thin caps can lead to problems. There is a bleeding in the plaque, and suddenly the size of this plaque and the obstruction in the artery increases. And what we saw here, that from 75%, it can go to say 99%. And then the patient gets what is called as a unstable angina because of plaque growth. Here is another situation where the cap is very thin and it ruptures at certain point and there is a bleeding, and this bleeding uh, narrows the lumen or the aperture in the artery, but it has not blocked it completely. And then what happens is this patient gets what we call as a unstable angina. Now, what are the features of unstable angina? There is a pain present for or increased in severity in the past few days or weeks. So earlier, as I told about the professor starts climbing the stairs, and after going up the second floor itself, he starts getting chest discomfort. That means it has progressed. And there is an increase in frequency, increase in duration. This time, the professor's chest pain stays for 5 minutes or 7 minutes, and it is not mild anymore. It has increased in severity. And there is a significant decrease in effort tolerance, means the professor was climbing 3 flights of stairs, but now he can go up only 2 flights. And here the inference is that coronary artery obstruction is present and progressive. Therefore, my friends, coronary artery disease, which is a huge subject, the first thing we discussed over several sessions was stable angina pectoris. And today we are seeing what happens in unstable angina. Later on, we are also going to see what happens in myocardial infarction or heart attack and why there are in some cases sudden deaths. All these three, unstable angina, what we discussed just now, what we are discussing just now, heart attack or myocardial infarction and sudden death, are together clubbed into what is called as acute coronary syndrome. As regards principal angina, silent ischemia, and other forms of presentation we'll discuss later. In fact, we have referred to principal angina earlier. But acute coronary syndrome can have three presentations. The first one we have discussed today, or we are discussing today, unstable angina. Now, just to recapitulate, what are the common signs and symptoms of acute coronary syndrome? The most common symptoms of both men and women is chest pain or discomfort, which is often described as pressure, squeezing, fullness, or tightness in the center of the chest. Aching or burning sensation sometimes. The pain may come and go or last for more than a few minutes. Generally, it can go on up to 20 minutes. It's an approximation, but more than 20 minutes, if it lasts, you have to think of heart attack, which we will be discussing in subsequent session. The discomfort may also spread to other areas of the human body, and that is arms, we have seen that, neck and jaw, back, stomach, or upper abdomen. Now, what is really important is the other common symptoms which come in unstable angina or acute coronary syndrome are shortness of breath, dyspnea, or breathlessness, which may occur with or without chest pain, nausea and vomiting, cold sweat, lightheadedness or dizziness and fainting, anxiety or a sense of impending doom. Now, my friends, let me just point out that these other common symptoms are more often seen in unstable angina, very less commonly observed in stable angina. Stable angina generally comes just as a chest discomfort or chest pain, but all these associated features, if they are added to progressive uh, chest discomfort, then the inference could be unstable angina. It is very important to go to a doctor if you are suspecting unstable angina. And what will the doctor do? He'll do a quick health assessment, see your blood pressure, examine you completely. Then certain blood tests are taken and the ECG is also recorded. In some cases, echo is a test that is done, which we'll talk about later. And in very selected cases, heart CT scan and angiography can also be done, may also be necessary. So, unstable angina is important because it can progress to a full-fledged heart attack. And I have already discussed about the features which should be observed. And if you observe any of these features, go to your cardiologist and get yourself checked. It is extremely important. Thank you very much. Today I have introduced the subject of unstable angina, which is the more progressed version of the stable angina, which we had discussed earlier. Thank you very much for watching this video. And needless to say, I am sure many of you must have subscribed to my channel. If not, please do subscribe, give me a thumbs up, and encourage me to give you more and more information about this very important organ that is our heart. Thank you very much. Thank you.